Hi, I'm Costa-Bir and we're here at the 8th Annual NIIM Symposium 2023 in Melbourne. I'm here with Dr. Nicole Nelson. Welcome to FX Medicine, Nicole.
Thank you.
Now, you've presented this weekend at the symposium. Can you tell us a little bit about your presentation?
Yes, so I spoke on fertility, and what I was looking at was sort of preparing before preconception, but also a little bit of troubleshooting if things go wrong and you don't get pregnant quite as quickly as you'd like to.
Amazing. Now, can you give us a little insight into what you talked about for our audience that couldn't be there today?
So I think a big factor is what we know is that sperm count has dropped by 50% since 1973, which some people aren't concerned about, but it only takes one. But there is some concern about why that might be happening. Fertility overall, there's been some reasons why women might be having trouble falling pregnant. So what we want to make sure is that dad gets included as well. And the big key message is to try and prepare as early as you can. So we want to make sure that our nutrient levels are really good. We want to make sure that we're reducing any toxins and things like endocrine disruptors, which people don't realise they're even in just everyday things like tea bags have plastic in them, you know. And we heard today from one of the speakers about the fact that plastics do change genetic expression. So in those first 10 days of embryology, which are absolutely critical, we want to make sure that we have the least amount of toxin exposure, but also that we have prepared beforehand to detoxify our bodies as much as we can. And then probably the other thing that's interesting is to look at reducing radiation exposure. Yeah.
What are some common sources of radiation?
So, I mean, you know, there's various sources of electromagnetic radiation. There's radiation, for example, flying. So a flight from, say, Brisbane to Sydney is the equivalent of a mammogram. And I would never have a mammogram in pregnancy, but I would happily take a flight. Having our laptops in our laps, having our phone in our pocket, you know, these are sensitive genetic material right near our reproductive organs, and it's one of the factors that they're saying may have contributed to declines in fertility and this issue that we're having with sperm counts. And it's just a principle we've always known with radiology to reduce radiation, so we need to think about that with products that we're using every day.
I think phones and laptops are a thing a lot of people do without even thinking about.
Absolutely.
Do you have a favourite nutrient or herbal medicine that you use for this sort of picture?
Oh, I can't choose. So folate, vitamin D, iodine, zinc would be my top ones, but there's quite a few others as well that we think about. Yep.
Amazing. And any lifestyle strategies that, your top must-haves?
Yeah, so, I mean, beforehand, trying to make sure that you're sleeping, and we had a talk today on sleep, so sleeping as much as possible, managing your stress, exercise, so getting those good lifestyle habits in place beforehand so that you're as healthy as you can be when you actually have those first critical months, but especially those first 10 days of the baby's development.
Amazing. Now, you've done a podcast with our lovely ambassador, Michelle. Can you give us a little summary, a really quick one of what you spoke about there?
So that one as well was on endocrine disruptors, one of my favourite topics, because endocrinologists worldwide in the research are screaming out about this and saying that we have to eliminate it from our everyday life as much as we can, but nothing's changing. And there's sort of, as I said in my talk, there's radio silence with a lot of health practitioners not even mentioning it. So things like tea bags, things like the lining of coffee cups, when you pour hot water into a coffee cup, a disposable coffee cup, that's an endocrine disruptor. We eat about a credit card of plastic every week, so there's a lot. And then there's also heavy metals and other toxins that we need to think about as well that are endocrine disruptors.
I can't wait to listen to that. So don't forget to find our podcast that you've done with Michelle. We can't wait to listen to that. Okay, thanks, Nicole.
Thank you.
Thanks, everyone, for joining us today. Don't forget to check our socials and visit our website for all our articles, infographics, and, of course, our podcast. I'm Costa-Bir. We'll see you next time.